Glenn Benton is a Wiradjuri man and a former smoker.
Heaps of my family smoked and I grew up to start smoking really young, and it really plagued my life in a lot of ways.
Now he uses his experience to help others quit.
A person who's lived a totally different kind of life for the past 10 years, and I'm really honoured and proud to be able to say that I can help other people to find that freedom from addiction as well.
Historically, tobacco was used as a payment for Indigenous Australians in exchange for labour. That practice left a deadly multi-generational legacy that's still being corrected. Now, a new study by researchers at ANU has tracked more than 1,300 First Nations adults for a decade to understand the mortality rate from smoking.
Up until now, we thought that about 20% of the burden of disease was attributed, and early death was attributed to smoking by Aboriginal and Torres Strait Islander people.
Co-author Tom Calmer is also the National Coordinator for Tackling Indigenous Smoking. He says what they found was far more alarming.
In fact, across the whole population group, it's around about 37% death attributed to smoking, or if you're 45 and over, it's around about 50%.
This is the first time researchers have looked at population-specific data for Indigenous Australians.
The death rate isn't rising. What we've been able to do is quantify how much of death is attributable to smoking.
According to the Institute of Health and Welfare, more than 40% of Indigenous Australian adults smoke, but that figure is in decline. So while these new findings are alarming, there is hope that things are starting to improve.
We're also seeing this amazing influx of energy and motivation for change.
Kirstie Wellauer, ABC News.